I'd like to introduce our first speaker, Associate Professor Linda Askenäs, Senior Lecturer at Linnaeus University, Sweden. Linda obtained her PhD in Economic Information Systems from Linnaeus University on the role of IT studies of organising when implementing using enterprise systems. She is now project leader of the multidisciplinary e-health research team, and Linda will present on integrated care for elderly living at home. Please make Linda welcome.
Thank you very much for letting me be here. As you said, I'm from Sweden, and I will present a project. We have a European project. Oh, there. And we are from different countries, mainly from Europe. Sweden, Austria, Hungary, and also Spain. And also we have South Korea. It's a Eureka founded project. And we are trying then to be both from industry, academic, and healthcare, public healthcare in the different countries, and also co-design with citizens in the projects. We use it in a co-design way. We have different use cases. So in Sweden we have trying to see how we can prevent fall. And in Austria it's more how to stimulate physical activity for elderly. And in Hungary is mental health. And the idea we have is to produce a platform using different kind of sensors, different ways to measure ways patients do and act, to see if we can use that kind of data to see first risks, behaviors, and try to take action before it actually happens, for example, a fall. If we can do that, we can prolong the longer living healthy at home. That's the main purpose. And this picture actually was drawn by the elderly we have in the picture over there, because they didn't understand really what we was doing about. So they did their own. But as you see, we try to really focus that all our experts, and we had elderly, and we had all the care chains with us, with different kind of physicians, therapists, nurses, and so on, also joining in Sweden. And that would be the same in Austria and Hungary. And what we actually tried to do, the project idea was that if you go to, focused on elderly, there will be a different kind of diagnosis. And I was running a heart failure project before, and then you come up with a solution at the market that are very specified to one diagnosis. And if you take elderly, you maybe have 5 or 6 different conditions for risk for falling, heart failure, diabetes, and so on. And we cannot have solutions for them, like for the heart failure. You have the scale and a tablet, just so you can use that scale and not using anything else. In that sense, should we have 5 and 6 different tablets? If you have different kind of diagnosis, it will not work. And you end up with the patients doing all the how to solve this 3 different recommendations maybe you get. So the idea was to actually trying to do a platform that, and also in the future, the sensor will change and we have different ways of treatments and so on. We need to have a stable IoT platform. So what we actually tested on them, so they have to test themselves, because when you really test yourself, you will be the good co-designer, otherwise it's hard, really. So they tested different kind of pulse sensors, different, and also at home, temperature and so on. And here's the area where we tested, just an example, and set up a different sensor at their home as well. And we found out that there are different personas discussion with them, because if they consider themselves as very active, and we of course we choose those who really would like to get involved in developing healthcare. So they consider themselves as active allies, but then they saw maybe the parents and so on, that there are different needs depending on where you are. So we construct Vital Hubert and Life Vitally. So Vital Hubert maybe is when you have some kind of care connections regularly, maybe conditions that you need help with. A Life Vitally is actually where you really are a care team taking care of you. And depending on this tree, you have quite different needs in that sense. So for active allies, at least in Sweden, we cannot handle all these active allies, or they need to prevent and take care of themselves. So what we can do there is to stimulate them to take measure and be progressive and try to see if they can learn from each other by comparing data with each other, and how am I in compared to others. Could I do some improvements? Maybe we can share improvements, what we do, so we can really learn from each other. And then also you can go to your health physicians and so on, or nurses, to use the data and share the data to get professional advice in that sense. So they really felt that this is something you do yourself. For Life Vitally and for active allies, they didn't want, they wanted to have control over the data, not that everyone could share and so on. So they decided I own the data. But when they consider Life Vitally, where you are really dependent, then it was not that an issue anymore, because you needed, you would like to have a really good care, and then you can share the data very much differently. And for Vital Hubert, it's a bit in between. And I also think you can see this is that you're growing older, but you can also pendle between those. For example, if you get a heart failure, you quickly can turn into Life Vitally, and when you sell that and get how to treatments and self-care, you can go back at least to Vital Hubert. So it can also pendle in that sense. And for this, we need a different kind of solutions, way to integrate. And this was just a test. And what we are suggesting here, that we have a platform view instead of taking care of each diagnosis. We try to use it that you can put a lot of different sensors in the bottom, and that can be changeable. Would you like? And then you collect the data. So what we now have usually, if we have those kind of sensors, they are stored in different islands. But we in this platform we like to collect all the data so you can actually use it from different kind of use cases. Because if you consider mental health or cognitive health, that could be very stimulating for being very physical active as well, compared to the Austria case. So using this kind of way of doing the platform view, and we will end up being supporting a lot of different use cases instead of just one or two. So this is the value of it. And for doing this, we also would like to have a more open business model. So we invite different kind of sensors, sensor providers being in. But this really, we are trying to do this. But it's really hard because they are really trying to build their own system right from the bottom to up. And then collect the data and make it even impossible to actually share it with different other communities, because in some sense they would like to own the data. And also you have to, in this sense, also get really really early involvement of the co-design. And what we have actually said, because we really try to treat the patient as the experts, we see that this can also be a way to sell in the platform. That, okay, we have this general platform, but in order to sell it to different kind of use cases or even multiple use cases, we need to use the co-design and productify way to involve the patient in each community, in each country, and so on. And I think for doing this platform view, we also need to have this. In Sweden, for example, it's just too small market. So that's why we also need to be at least at the European level. But of course, we like to come here as well or collaborate. And the idea is also that we can have different kind of providers in these different levels, different kind of sensor providers that already maybe are used at the hospital that could be integrated. We can have different kind of analytics levels, companies coming in and help us to do really good analytics, because now, at least in Sweden, we have this quality register for the whole nation. A lot of data is gathering, but we don't really use it. It looks nice and everything, but do we really use all the data we gather? And we don't. And that's also something we need really to focus on. But the main thing, what we really think, is to focus on the patient. So it's the patient that will get the support and the data and understanding of her or himself. When you get that understanding and see the patterns, then our thinking is that you really get an incentive to change, doing these lifestyle changes that you actually need if you, for example, have got heart failure or diabetes and so on. So the idea is also to get this learning curve, to plan, do, act, and study in this kind of applications, in the application levels. And if we can also do that at the community level, that would be great, because then you can learn from what others have done. And yeah, I can also compare myself to, okay, if you take it in the long run, I can compare my data to others and see, now you have a higher risk because you have been more not so active anymore. So now you have a higher risk to get diabetes, for example, in your age group and so on. And that maybe stimulate me to actually change that kind of risk levels. So that was really nice, because the co-design approach with the companies, when we worked with them, they were not that founded, they didn't understand really. But now they actually have it as a selling point going out, that we really need to co-design this together with the whole care team and around the patient. So what we come up with maybe is a bit, but to have a co-design in each level. So what we did in the beginning is investigate the needs and so on very broadly. And now we come up we are in the co-developing and trying to push it into the co-implement. We have done testing, but really to implement it in a system. And we need to have the business going on. That's what we were a bit late on, to really see how can this be paid for, who will pay, and what would they like to do. So all this thing, and then also see that the user are designers, but they also evaluators. They can also be used in the implementation as trainers and advisor in the later stage how to change the system. And also when it comes to the framework, you can have this kind of basic framework for this rule setup for security and the data, how to share data and rules for that. It's a lot of different laws in different countries and so on. We need to set up. But as far as you go to implementation, you have more focused framework in that sense. Yeah? I think it's time, yeah.
You've gone ahead of time.
It's 1 minute.
Thank you, Linda. Now, I was wondering if we have any questions from the audience.
Thank you for your interesting presentation. Could you just tell us a bit about how you're working this collaboratively across all these different countries? Or is it basically designed in Sweden and other people are testing it?
No, as I said, in Hungary, for example, we have mental health focus. So they have this, we have been, so they focus on mental health. So one solution they have is it's ordinary gaming when you play cards on the computer. So what they do actually measure behind that. How do you progress? You are quicker, and they have different kind of poll tests and so on, so you can actually test the way. So what they gathering the data for those who game anyway. I don't know if you have done this Sudoku and so on, and then measure behind that, and then they can see for if you're coming better or worse, and get signals. So they are doing that and co-design, and we actually went co-designing with them to see how they can, because they usually just tested the system on the users. But in a way we would like to co-design is that actually the elderly feels that they are able to co-design and have really critical questions. And we really shifted that. In Austria, it's about active, so they have an avatar you can train with. And then the physician in Sweden, for example, when they tested it in Sweden, they would like to see, because then they see, okay, you can have the avatar, you can have much more guidance, but she also would like to see and interact remotely in the rehab situation. So we have different kind of solutions. That's what we test the platform with. Can the platform support all these different ways of not just sensors as we test in Sweden, testing different sensors, how they can be integrated and so on. So we can you integrate the result from the avatar training program or the gaming part and so on. And in Korea, it's Glowpoint. They are using VR technology. And for example, for Active Alice, it's a lot about awareness. So can we get her to be aware of the risk of falling? So they have this where you go in a VR room or a flat to identify all the risk, carpets and all different kind of risks in that sense. So we stress the platform thinking by using different kind of technologies.
Do we have any other questions? No? Okay. Please join me in thanking Linda.
Thank you.